Dr. Chapman,
Owen.
welcome to your office. Okay.
Thank you, and a beautiful
Yeah.
office it is.
Before we get into more of like in detail of what we do here at the Lift Clinic, and obviously, you know, how we help and treat others, we first need to understand why we should trust you as an individual. So,
That's good, because I'm
please.
trustworthy, number
Yes,
one.
yes.
I've worked hard to become trustworthy.
Yeah, and so we need to define, you know, how you ended up here
Yeah,
and your credentials, of
yeah,
course.
for sure. Credentials is always part of, typically we think if
Sure hope my
somebody's,
doctor has
if somebody's
great credentials.
credentialed, they have they kind of have all of the qualifications of trustworthiness. And sadly, in the world we live in, sometimes that's not
Yeah.
necessarily the case. But for me, so first, I have just an organic passion for helping people. And as a result of that, that's taken me down these courses in the pursuit of understanding and knowledge and degrees and, accomplishments that, that sort of present themselves to the world as a credible guy. So, I've been practicing. I got my doctorate in chiropractic through Palmer College of Chiropractic, which is the old, it's the fountainhead. It's the Ivy League school of the chiropractic
Pretend
profession.
I'm like 5 years old. I don't know what that is, but like, okay, so the head of chiropractic, and how did they? Do you know any history about them at all?
Oh yeah, for sure.
Okay.
For sure. And back in the late 1800s, there were two doctors. They were actually good friends. One of them was named Andrew Still, who was really kind of a vitalistic sort of practitioner. And we'll talk about vitalism a little bit because that's part of the origin story of chiropractic.
Sure.
And it's the origin story for osteopathic medicine as well. So, and there was another fellow who was a magnetic healer. And mind you, MD degrees were, we were we're still slapping
Figuring
leeches
it out,
on
yeah.
people, And no, it was, anesthesia had just been discovered, and so
Oh,
it was a brutish profession.
Sure.
And so Dr. Andrew Still and Dr. D.D. Palmer were both kind of exploring some of these vitalistic elements. And in D.D. Palmer, who lived in Davenport, Iowa at the time, he had a practice there. And there was a fellow that was the maintenance guy. He was the janitor, we would call it, but the building keeper, back in his office building. And he was deaf. And one day, Dr. Palmer noticed that he had some sort of a weird posture and a weird spinal thing going on. And this fellow's name was Harvey Lilliard. And he basically said, "Harvey, come in here. Let me take a look at that,"
He looked
Of course,
off.
Harvey didn't hear him when he said, "Harvey, come in here." He had to get
Oh,
Harvey's attention
yeah.
in another way. And so, so he put Harvey Lilliard on the table and he adjusted this lesion, this bump, this structural malady that just didn't seem right. And when he did that, Harvey got his hearing back. And that was the beginning of chiropractic. This idea, it's like, whoa, what if there's more to this? And so D.D. Palmer was really the first to start making these excavations into this discovery that there is a different way.
That your body isn't perfect
Yeah,
in
yeah,
any
there's-
way. Yeah.
And at the time, vitalistic medicine was just rising. It was kind of like drifting up into the collective unconsciousness
sure.
of humanity. And so we have doctors like Andrew Still, who then went and founded an osteopathic college in Kirksville, Missouri, and then Daniel David Palmer, D.D. Palmer, founded Palmer College of Chiropractic in Davenport, Iowa. So it was the first college, and that's why we call it the Fountainhead. And
Sure,
even
yeah.
Samuel Frederick Christian Hahnemann over in Europe was founding homeopathy. And so there was a kind of a renaissance of,
It was a big thing at the time.
yeah, it was really cool. And so, as it turns out, historically, in my pedigree, my great grandfather was one of the first graduates under
Oh,
D.D. Palmer. So there's some
hereditary.
There's some there's some heritage there,
Yeah.
and some inclinations. So, you know, that whether that's in one's genes or not, it's hard to say. But so I was led into that profession. At the time, back in 1990, the early 1990s, I was running my own engineering firm, and I had an accident, and I developed headaches as a result of that accident. And the irony is that the person that actually hit me in the car was a person who fell asleep at the wheel, probably because they had undiagnosed sleep apnea. It's before CPAP machines,
Sure.
you know,
Yeah.
and crossed traffic, slammed into my car, and I had this, you know, I wasn't dead, and my car was mildly damaged, and but somehow or somewhere out of the blue, you know, about 4 or 5 weeks later, I started to get like headaches. I'd never been a headache person, and those headaches got severe, like debilitating. Like I had the aura, and I couldn't function. I couldn't function in work, anything like that. And so I went down to the local chiropractor, and I'm like, hey, can you do something about this? And you know, so he gave me my first chiropractic manipulation, and it was a manipulation.
Yeah. What did that consist of?
It was aggressive. But that type of chiropractic actually is what sort of like began to deflect
It's the gateway.
my awareness, into like, wow, there's something beyond just, you know, ibuprofen or medication, or sadly, you know,
Right. Instead of like, I guess diffusing it for a
Opioids,
short
yes.
time, like actually
yeah.
go to the root of the issue and
Right.
change
And
it
I
out.
did those things, you know, temporarily and to no avail. It just, you know, it might have had a pain blocking benefit, but especially the opioids, you know, that it just like, it made me feel like it made me groggy, you know, so I didn't like the way it made me feel. So I sought other options, you know. And I think that many people have that course. But so when I was with the doctor that I saw, the chiropractor that I saw there, he essentially, one day I was sitting in his office, and he was a nice guy. He would even come to my house and adjust me because I was having more headaches.
Was it really that debilitating? That you just couldn't?
Yeah, it was hardcore.
Wow.
Yeah, it was hardcore. And so I have a great deal of empathy. So like a huge part of my practice now, all these years later, is treating individuals who had the same sort of malady that I suffered from.
That makes a
So
lot of
I
sense.
have a lot
now.
of empathy
Yeah.
for that. I have a lot of empathy for that person that's in that kind of physical
Oh yeah.
pain crisis, you know, especially when it becomes chronic. Then it's like, then it just sort of settles into your whole life and shapes and contours every attribute of your life and your work and your relationships and your sleep and you know,
yeah.
so it's really rough. It's a rough gig. But while I was my time with the doctor, I don't want to mention his name, but
Sure.
while I was, even though I really respect him, his name's Dr. Mangum, Lance Mangum, and in Springville, Utah, and essentially that experience there kind of started raising these questions. And one day I asked him, I said, Dr. Mangum, what does it take to do what you do? Because I loved his explanations, because if I had a question, it wasn't like, well, I am the high, mighty, white-coated
We're gonna
physician
move it,
here,
and you're gonna feel better.
yeah, we're gonna just do it, and if you have a problem with that, then something's wrong with you.
Yeah.
You know, kind of approach.
It's like when you go into a
and I was
doctor's office, and like,
encountering
we're
that
gonna do
at the
this
time.
and this and this, and you're gonna feel better. It's like, I don't know what those things do, but I'm glad you say I'm gonna feel better, I guess.
Yeah.
Yeah.
You just kind of trust. And so he would explain things, and I'm very much I like explanations, as you know in my practice.
Oh, yeah.
I don't hold back on explaining things.
Yes, being
the
precise
curious.
is very, and
It
meticulous is very, very important to you. Yeah.
It really is. And so he said, you know, here's a set of this. Back in the day, you probably don't know what these are, but they're called cassettes. cassette tapes.
Deal.
You do.
Barely.
Yeah, barely. They're in the museum.
I was born 1 year later. I'm out.
Yeah, you're out. Yeah, thank goodness. Well, they were troublesome. They weren't as bad as the old 8-tracks, but essentially, it was this doctor, another PhD that I highly respect, a fellow by the name of Dean Black, and he was a PhD, taught at Brigham Young University, but somebody had recorded his lecture that he had given to the Australian Chiropractic Physicians Association on what happened and what the chiropractic adjustment actually was. And he pointed out this vitalistic origin in this, and this is where I first came across this idea, like in a concrete form, that the human body has the ability to heal itself if you remove some of the impediments or an impediment that was causing that dis-ease or disruption of vital health. And this philosophy is kind of encapsulated into that thing that is really the heritage of chiropractic, which is this vitalistic idea that the body has an innate ability to heal. You just have to sort out how to provoke it out of the body.
Sure, yeah.
Does that make sense?
Yeah, absolutely.
As opposed to like what we would call atomistic, where we can give molecular orders to the body. We can block receptor sites. We can mimic a system or a behavior of a system. We can shut this down, or we can take it out. If it ain't working, throw it in the parts bin, gallbladders and, etc. I essentially discovered right as I was matriculating and starting my first trimester at Palmer. And the hours are significant. We do trimesters, and those are 30 semester hours.
Wow.
So instead of like full-time is like 15, this
Yeah.
was 30. So I was in school from 7 a.m. to 5 p.m. and then labs and other stuff on top of that for 5 years. And so with that program, it's a busy program. With
I'm not sure anybody would even put in that
much.
much work anymore.
Yeah, you really have to respect the work that the chiropractor does in their education, because there's options open to them. They can be dentists, they can be osteopaths, they can be medical doctors. They can pursue any of the academics, PhDs, master's programs, but instead they choose to march into this, the ugly stepchild of healthcare sometimes, of medicine, to deliver a product that is transformative to so many people's lives against the resistance and some of the conventional, thinking that we all just adopt, that if your doctor's wearing a white coat and they have an MD behind their name, you should listen to them and trust them with what they're saying. And while I consider that profession very, very trustworthy as a whole, we've really seen it go down a bad hole.
Well, I think we can just
lately.
trust that no one knows everything, and not one doctor can have the answers to every problem you have.
It's
right?
It's very true, and more we're seeing this collaborative sort of effect. We're seeing a lot of collaboration between dentists and chiropractors and medical doctors and naturopaths. We're finally changing. We're getting to another renaissance.
Well, bodies are complicated, and to assume that one practice is just going to solve each issue you're having is just it's kind of crazy at this point.
And your principles have to be as clean and as clear and as relevant as the body is complicated. But that kind of led me to this. That's what led me into the profession. And so I matriculated. I matriculated in '93, graduated in '98. And I started my upper cervical practice purely doing the atlas work, head on the neck. That was my focus. I'm interested in a lot of things, but I'm not a jack of all trades kind of guy. I'm kind of really inept in some things, but in other things I'm really good at. And so, because I'm focused in those things, and if it connects to my heart, my head signs up and we're good. I'm good with it. But I started practicing an upper cervical technique called NUCA for the first 10 years. And I loved it because it was precise. It focused on pre-post procedural imaging, so you could actually measure something, not just, jump on somebody, twist them and say, how does it feel? How do you, and get them on a revolving door relationship.
Yeah,
with
and
you.
it's not trial and error.
Yeah,
until they're like, I'm feeling great.
Yeah, this particular meticulous upper cervical protocol really emphasized like putting the head back on properly, opening up this vital channel where like almost all of human health is mitigated somewhat, if not, majorly through that area, putting that back into position, and then learning how to step back and watch patients heal. But prior to being confident in doing that, you had to know that somebody came in with this kind of measurable condition or status, and they left changed. That's the thing. You can't. This is not, placebo doesn't work.
Well, yeah, it's a
that often.
I mean,
At
its base is just the scientific method. Do you
Yeah.
have variables that you can accurately get every single
is.
time? Do you have things that are just going to be like, well, I guess
Yeah.
that can change, I
Very
guess.
little trial and error on the patient. Like, try that, and if that doesn't work, then we'll try this, and
Yeah.
up that and down that. This is like, you have these conditions, and I suspect that those conditions are caused by this type of misalignment, which, by the way, is measurable and discernible with imaging.
Yeah.
And so that's why imaging is such a huge part of
Well,
this.
and we'll have people come in all the time for like consults, and they'll be like, I've never had a doctor like pull up my x-ray right in front of them, do the math right in
Yeah.
front of me, show me that twist, and then continue to show exactly how we put that back into place.
Right
and it's
on.
like, you don't get that.
and correlate that to the symptoms that they're
Yeah.
coming in for in the first place.
Mhm.
That's really important. And so, yes, so that's really essentially how I started out, very, very image focused. And so I gained a lot of faith in the procedure because I could notably and measurably see the changes. And to the credit of the upper cervical techniques in chiropractic, they really do have a meticulous, some of them more so than others, but they do have a meticulous pre-post verification program so that you can feel, as a practitioner, you can feel confident that you did what you set out to do.
Mm-hmm.
And then when you see the actual corresponding changes in patients, what that does is it validates the original premise of vitalism, that the body has the innate ability to heal itself,
Sure.
encased in it in some wonderful, marvelous way,
Mhm.
that we still yet don't fully understand, how that collectively enables the body to be alive versus dead.
Yeah,
for
and
instance,
It's hard when everybody's different and has gone through many different traumas
right on.
in all of life. So
Right on.
trying to calculate that would be like,
It was super difficult because
yeah.
in the genesis of this, and this really has bearing on where we are right now, because we really are on the forefront of developing imaging and interpretive models
Mhm.
especially for the upper cervical and the dental industry with what we do here.
From them walking in to actually getting like a vector, which we'll go into later, but like,
you-
how long did that take?
It was about 2 hours. So it was about 2 hours. It would take some time and so forth. But now it's like 2 minutes.
Yeah, because
You
you
know,
have
it's
online
like-
tools that just allow
Yeah.
you to
Yeah.
easily
Yeah, we
throw
capture
stuff on.
we capture the image. That takes 30 seconds. It's processed and assembled in 3D before us in another 30 seconds. So really, we have that image data there, and we can manipulate it and look in and up and around and expand it, and
Yeah.
even send it to a 3D printer if we want. So technology's really been our friend, and we've really been the early adopter of that. And so the problem that we had back as chiropractors looking at the 3D body, because the body's not only 3D, it's temporospatial. So it's structure over time, regenerating, degenerating, genetically switching on, switching off. You know, there's a whole aspect of looking at the bodies now that we can look at. And then we had to take 2D images, and we would take opposing views, like we take a front view, a top-down view, and a side view, and from those views, we would extrapolate out a 3D understanding. But now we can actually have a 3D understanding.
And I guess would that correlate, because obviously still what we do here, I don't think many would consider mainstream.
No.
And not something that's well known, as it definitely should be after going through it myself and obviously learning about it. Do you think as technology and as just people learn more about their body in such a rapid succession of knowledge, do you think that will only push it to be more mainstream, or do you think we're going to plateau at some point of like, you know, the knowledge of this specific type of chiropractic?
Yeah, I think we are, I think all professions have a certain plateau, and it's a part of human psychology and complacency and comfortableness.
Sure.
You know, we get into our zone, and then it becomes, somebody else though is not at that place. They're hungry and innovative and progressive. And
and the next thing comes
when
along.
certain professions reach a state of complacence or inadequacy or insufficiency, or they're causing harm, thinking people that actually think about things and problems, and nothing makes you think about a problem like suffering, stuff like having a problem and having to solve it, they begin to reach out. And so as we become more open to new things and innovative knowledge sets and so forth, I think that bodes well for what we're doing here, because we are purely science-based. Everything we do, everything we intervene in or propose to intervene in, we have a foundational study that measures it before we intervene, whether it's the parameters of their sleep, whether it's the nuances of their bite, whether it's the way their head and neck sits on their neck, whether it's the way they stand on their feet. We have a measured starting point, and we influence the body and influence the patient, and we have measurable changes. So our 95% success outcomes, eventually that voice, even though it's a small voice and it's kind of quiet here in the Salt Lake downtown area, that voice eventually, it holds, it has staying power because it's doing something good. And I think we need to make an effort to get it out and present the work in a coherent manner that is, and that's why we're largely, doing this kind of series here where we're talking about what we're doing here.
And one thing I mean, do you think it'd be a fair assumption to say, as it becomes easier to understand this and easier for, a bigger majority to do you think the reason why a lot of medical things plateau is because we're starting to get people who, are like, oh yeah, I can do this now, and they really don't put in the work as like you've done to get deep into, the hard parts of it. And we're going to start to get people who are like, oh yeah, if it's just repositioning the atlas, I can do that with...
It's coming. I've often felt like I'm the guy with the machete hacking through the jungle.
And there's a guy behind you.
I've been doing it like for 10, 15 years alone. And then, you look back and you've got a trail, and then there's footsteps, and then there's more footsteps. And they're marching down the trail. And these are people who didn't have to, they're smart, they get it, they're on the trail because they resonate with the ideas and the work.
But I feel like eventually they'll hit a part of the trail, like, I found the treasure. They stop there, you're still going, and
or
other people will follow
I'm
you
off
forward.
to the side of the trail going, man, I just need some lemonade and a wet rag on my forehead. And they're like,
they stop and they wait for you, and they're like, continue when you're ready.
Continue when you're ready. Right. And so, that's a good perspective, Owen. It is. I think we've opened up some pathways, especially with our work on understanding and measuring the correlation between an atlas subluxation, the misalignment of a head on the neck, and its impact on something as simple and as huge as the upper airway, because breathing is, not to be underrated. It's like super important, obviously. And
Well,
so,
I mean, it's been like science. I mean, it's been in health for histories, meditation, just breathing techniques, things like that. You don't have that airway, you're already cut in half, I guess, in that way. Yeah.
Yeah, that's so true. And yet those things that have been on the planet for millennia, and in certain cultures, in Eastern cultures, and Asian cultures, they're not in our Western culture. We go to medicine, we go to drugs, we go to CPAP.
I mean, the one thing I know of is like the Army's technique to like fall asleep is like a quick little breathing exercise, and you kind of pass out somehow. I don't know how it works specifically, but
yeah, breathing is super important. And so just the kind of the knowledge that we've brought forward with how to intervene in the craniocervical junction and measure corresponding changes in the airway. That's the big portal into upright posture, proper upright posture, because breathing and the capacity of the upper pharynx to move, to ventilate the body, basically that's what it does, allows us to maintain an upright posture rather than going into a compromised, CPR upright posture, which is head forward, slouching down. It doesn't help that we have instruments that we look at, on a continual basis, like our phones, and our, our
neck down,
iPads, et cetera, But also for sleep medicine, it's huge when you reposition the atlas and you open up the central neurology and the flow of cerebrospinal fluid into the head, which has had its own renaissance in the last 5-7 years. The whole model of CSF movement has changed. But as these things develop and as these great ideas start coming together and seaming together, we can see why there's a relationship between obstructive sleep apnea and neurodegenerative brain disease, and why things like opening up the craniocervical junction improves sleep and brain health, because cerebrospinal fluid can now move into and out of the cranial vault, not simply with the impulses that are generated by the left side of the heart with the systolic wave, but primarily by inhaling and exhaling. That is the primary pump for cerebrospinal fluid movement, which keeps the brain clear of all of the debris that ends up in all of the neurodegenerative diseases. So breathing, that like fundamental thing is what drives brain health. And so we can see massive improvements in human health by looking at a certain area, handling it the appropriate way, and then onboarding really cool techniques that are non-invasive to actually prevent relapse of that system, so that you don't have a little day in the sun and then the clouds come again as soon as you lose the alignment
every single time.
So that's been a big part of my work. And the cool part of that work is that, and this speaks to the question of credibility where we started here, is my clinical protocols over the last years have really involved bringing other practitioners, particularly the functional and the biomimetic oriented dentist, into this upper cervical space, where it's you don't realize it until the connection between dentistry, the teeth, the way the teeth come together, and the way the head sits on the neck, until you see it, until you know it. Even though every dentist that has looked in your mouth, if they look in your mouth and pull the uvula aside, they're looking right at your atlas. It's 2 millimeters under the tissue on the back of your throat. There's the atlas.
So, I mean, knowing obviously the struggles of being misaligned and being aligned, how many people should actually care that they might be out of alignment?
I think everybody should keep it in the back of their mind.
Okay.
You know, I mean, it's like my personal experience is that if you want to live a higher level of health, even though you're not in pain, make sure your head's on straight, because it really does increase your vitality. You sleep, you do everything better. In the same way that if you drive a car, and the car is in alignment and well working
And maintained.
condition and maintained, it functions better and lasts longer.
Yeah.
Most people have to hit the wall, you know, unless they've been raised in a culture of health, in a family. Like my children
You'll
were.
find that with like everything
Yeah.
though. Like nobody cares about their health until something hits it.
Right on.
And then they're like, oh, maybe I should start caring again. And really,
Yeah.
you'll find it with like everybody who's really, really critical about their health is because something's happened in the past where they're like, I just let it go.
Yeah, yeah.
I didn't maintain it and try.
And then they hit the wall of regret.
Yes.
And then they're like, oh crap.
Yeah.
Those are the people we talk to. Yeah, we talk to a lot of those folks, you
Yeah.
know, who are not the nice, clean, lovely wellness world. We deal with the battle, the embattled, hardened,
I mean,
beat up.
And they're
you
strong.
know,
I mean, they're
trauma
strong, but like,
Yeah.
it's just finally they hit the just, I can't. Like, it's everyday life. It's tough.
Yeah.
And like, even people who come in who don't have that, you can tell they're just like, I don't want to hit that wall. And
Yeah.
it's
Yeah,
pre-prepared. Yeah.
And you see this. I mean, you don't know how good it can be until you experience it. You've seen transformations with patients in this office that, you know, that have just become different beings. You know.
I'm so surprised by the emotional aspect of it. People come in like
Yeah.
doubtful, hopeless, I would say, and
Yeah.
then come back out. They're walking down the hallway over here, and you can just see a smile.
Yeah.
It's something that subtle where
Yeah.
you're just like, you can just see that return of like
Yeah.
that happy behavior of just like, okay,
What just happened?
yeah.
That perplexed smile.
Well, and
I've
even if
come
it's
to
not
love
like
that.
the biggest change, it's change.
Yeah.
And that's new to some patients. That's hopeful.
Yeah.
Yeah.
It is, and then holding the pathway and just letting the body heal out of that. But this idea of not having to just continually return for another adjustment, another tap, again and again and again. But well, there are some, admittedly, that do. They're the undiscovered country. You know, they're the treasures of patients who you got to solve that. I'm working on that actually, because not 100% of the patients have complete retention, even using the technology that we've developed and have. But the reason we have developed and have the technology that we do have is because I've continually sought a solution to that problem.
Right.
You know what I mean? And so that technology of bringing into the whole functional aspect of the maxillofacial and dental and mandibular system and how that works and how to measure it and how to stabilize it has really brought us to the point where we have been accepted into, you know, postdoctoral accredited programs, where the Diplomate program that I went through, which is my postdoctoral work that I did in Chicago, that's now a module, an advanced module that every diplomate in chiropractic craniocervical junction procedures has to go through. So they have to pass through the portal of our clinical knowledge and our practice principles, because they work and they're sound.
Mm-hmm.
And that's a great compliment from my distinguished profession and from, you know, Sherman College of Chiropractic, who sponsors that program and who lends their accreditation through that. And it's not easy to get an accredited curriculum put together. And so this is something that that we enjoy. We enjoy that we do that. We don't talk about that much. It's our protocol. We do it here. Other doctors and dentists have kind of incorporated the principles, but it's not the fundamental pure work that we do here.
Mm-hmm.
But the cool thing about pure principles is that they can work in a lot of different environments
Sure.
very effectively.
Yeah.
And so I've really focused on teaching the science and the principles.
Last question for you. It's a little bit of a combined one. I guess the first part of this question would be, what is the, in your opinion, when you are studying something new or you're trying to put together a new study, what is the aspect of it that makes it the most fun for you? And then the second part of that question is, I guess, what's the best way when you're figuring out this sort of new, I don't know, new idea or new way of thinking? Do you see it get muddled? What's kind of like the process it goes through? So I guess
Wow.
what's the best part about that, and what's the worst part about, treading
Yes.
new ground?
Yeah. The treading of new ground, I don't do that just because I like to tread new ground.
Mm-hmm.
I do that because a problem takes me to the brink of that non-trailed jungle. It's uncut, right?
Yeah.
And so we present ourselves with a problem, and the solution is either not great or there isn't one. Actually engaging in the conversation, the wrestle, the exploration of identifying and understanding what the problem is, and what are the terms, what are we actually dealing with here, and why. So you got to get some of those basic things out, and it's a thinking exercise, really. It's like, am I looking at this problem correctly? It's one of the fundamental problems and principles of diagnosis. Hey, doc, it hurts when I do this. Well, don't do that.
Yeah. Yeah.
It's kind of the crudest form of diagnosis and cure. But if somebody comes in with like something that has a symptom or a sign, clicking and popping is a sign, pain is a symptom, what's going on there? And when did it start, and how did it start? And if everything is sort of like it came out of nowhere, it started 7 years ago. It gets
Right, then
better
the discovery
sometimes, it gets
happens,
worse
yeah.
sometimes, and sometimes it goes away. But it's not going away now, so I'm coming back to see you. I'm coming to see you because I've had it for like 4 months, and it's getting worse and worse and worse. And it doesn't seem like it's going to come and go anymore like it did.
It's here to stay.
It's here to stay. So that's an example. But facing a problem and then getting in, presenting, stepping forward in with a solution to that problem that is built on hopefully an understanding of what caused it and why it's there, and then you propose an intervention. And an intervention is like a hypothesis. You
Mm-hmm.
have this, I hypothesize that it's caused by that, therefore let's implement this to solve the problem.
Sure.
Even in the most crude sense, in kind of like more invasive medical terms, that nerve is being pinched, so let's numb the nerve. Let's kill the nerve. It's crying out in pain.
You go the extreme. And,
Yeah,
yeah.
and it is a problem and a solution. It's another version. It's a more sophisticated, invasive version of it. Hurts when I do
Really
that, then
going
don't
direct.
do that. It just blocks the nervous system from knowing that you're doing that, basically.
Mm-hmm.
And so with this kind of work where we're not cutting anything out or blocking or numbing anything or even kind of like hardening the body.
Mm-hmm.
We're listening to the symptoms, and we're looking at the signs, and we're interpreting them, and we're proposing a solution to that doesn't work against the body, but works with the body.
Mm-hmm.
And when those treatment protocols become consistently effective, the best part of that is that as a physician, with the oath to above all do no harm,
Mm-hmm.
I'm honoring that oath. because I'm not harming the body unknowingly, unwittingly, unintentionally. All the good things of harming the body versus malicious harm.
Yeah.
Very few doctors do malicious harm. It's rare. The unknowing, the unwitting harm is what we have to guard ourselves against. And so when I intervene and figure out a way that's consistently delivers results, the best part of that is actually knowing that I'm working at a moral, ethical
Level.
basis that is gratifying and brings peace. The most difficult part of that is
like what happens when like the
figuring
discovery
it out,
like,
and the trial and error.
Is there an aspect of it like when you have solved it, it's out there,
Yeah.
right?
Yeah.
It's out there.
Yeah.
Because I've heard a lot of things. It's like we figured it out.
Yeah.
And then I just never hear from it again.
Yeah.
And I'm like, what happened?
Yeah, it's very true, and it's very difficult in a you guys. I mean, you having a team that can handle like you saying, hey, we're going to start doing it this way now, because I say that a lot in this practice. Hey, I want this done before we do that, and I want this measured. I want to incorporate that into our protocols. Having having a staff and an organization and a system and the resource of this clinic, which doesn't come easy, but having all of this available is, and willing souls to jump in and participate and implement these things and trial them, and then we evaluate them, has been a real positive side of this. I couldn't do this alone. And to be honest, I couldn't do this alone. A lot of the technologies and the techniques that I use, I don't go sit into the back room and just pop out brilliant thoughts, Nobody ever suspects that anyway, but I've listened and been exposed to a lot of really brilliant practitioners, a lot of good thinkers, and I've been exposed to a lot of good principles. So I stand on the back of giants, and I could give a long pedigree of individuals that I've associated with who have influenced my thinking. And the common denominator amongst all of these men and women are they're thinkers. They know how to think through a problem, and they brought principles and ideas that have, in the same organic way that my work has evolved, their work has evolved in that way as well. And so I just want to be there to
be the next stone.
Have something, that can be foundational and sound and solid and argued with and, talked about for time to come, because the outcomes and the results were meritorious, they were effective. So that's another really gratifying aspect of what this work has become, because I've stayed with it. I've continued to pound away at it, and it's been a very, very enjoyable process.
Yeah.
I don't know if I answered your question with that one or not, but
I think that was pretty good. I think we can call it here. I mean, I know next time we're going to kind of go over more like...
Yeah, what are we going to talk about next time?
So next time we're going to go more like the clinic itself.
Yeah.
Your process of starting it, and then as well as just like, what can you expect when you walk into our doors? What's the process we're going to take you through? What are your expectations once we have, sat you down and we're like, why do we do a MAT scan when you come in first? Why do we do a CT scan you so graciously do it, for free? Like what built us there, and why we continue to do those things as we go? The device you built, which is something that I know is very, very unique to our practice and something that, prevents the revolving door. I feel like we should get more into that and what exactly sets that as sort of like, I feel like that is more or less the stone of like all of a sudden now people, I know way too many chiropractors around my area, right? And they can have so many chiropractors because everyone's going to continuously need it. And now, you might only need like 2 AO people in a certain city, and all of a sudden, as long as you're continuing to do that right, and obviously there's going to be problems, if somebody's wearing a device. But going more into the details of, even coming up with a thought of a orthogonal device.
Yeah.
Because I didn't think about it. I walked in here and I'm like, oh, great, they put you back in correction. And they're like, well, that's not it. And now there's a device that I wear at night, and it's really unique.
Yeah.
I never thought any of this would play into my sleep.
Yes.
General health. Yeah.
What's interesting is you think about the professions, and all of the professions, it's like those professions arose because of big systemic problems. And so I thought that one of the most noble goals and ambitions of any of the profession is to simply solve the problem that caused the formation of the profession in the first place.
Yeah.
Think
It's
of law.
weird how that is.
You're
You're like destroying your own career.
Yeah, it really is. It's like, and it's like, like lawyers don't want to destroy, conflict because
they need it.
Because conflict has become the final. Medicine doesn't want to destroy,
but at the same time,
disease because it.
I mean, at the same time, it's not like there's never going to be people. I mean, we can help solve the issue, but there's going to be. I mean, we have very young adolescents come into this office.
Yeah.
Like, there's always going to need the practice. So
yeah.
Even if we get rid of the revolving door afterwards, that doesn't change the fact that there's people who are still going to be brought into this world with issues.
Right on.
Yeah.
Right on. Right on. Especially now. Hopefully we're going to be part of a big turn in human health, body health, mind health, spirit health.
Yeah.
All those cool things.
When as more influential people do the treatment, which they have, and we'll get into that, it only goes up from here.
Yeah, indeed. Well, thank you. Thanks for interviewing.